is Wellness Wednesday, and today we are talking about your knees. Joining us in studio this morning with more about knee health, we welcome Dr. Rami Kurdi to the show, an orthopedic surgeon at Memorial Healthcare Center for Orthopedics. Good morning to you, sir.
Good morning. Thank you for having me.
Yeah, thanks for being here. You know, a lot of folks out there can have trouble with their knees. What are some of the most common knee problems that you typically see in your patients, and what's causing that pain?
So many patients come in for different reasons, and a lot of times it's just life. People put a lot of wear and tear in their knees. Sometimes it's trauma, an acute injury, and it can be a tearing of some cartilage, or oftentimes it's just that you have some hereditary component, maybe some arthritis, or it just kind of came up out of nowhere and never really went away.
But bottom line, a lot of us are hard on our knees, right? We need them.
Yeah, absolutely. You walk on it every day. Unless you're staying in bed, you're using your knees.
Yeah, that's right. And so, you know, how do you determine then whether a patient needs surgery versus more conservative treatments like physical therapy or injections, things like that?
Yeah, patients come in just with knee pain, and sometimes when they book the appointment, they have pain, and when they show up, maybe not so much. So it's not about what treatment they need, it's about what do you do in your life, what caused the pain, and what do you need your knees for. So we tailor the treatment to the patient and not the patient to the treatment. So a lot of times it's injections, sometimes it's just lifestyle modifications, weight adjustments, activities like strengthening and conditioning, physical therapy.
Well, yeah, expand on that a little bit. How can things like physical therapy make a difference?
Really, your knee, imagine it's a structural mechanical movement that you have to buttress and protect. So your muscles, your ability to respond to sudden movements, it protects twisting and injuring, any injuries that you might have. So it's more protective, and it prevents injuries because you're more conditioned.
All right, a step further than that, though, say you come to a point where it's decided that surgery is needed. Can you explain what happens during a total knee replacement and how that works?
Yeah, so total knee replacements are different. They are the end stage when you've gone through a lot of wear and tear, you've tried injections, lifestyle modifications, all the conservative measures, and we've determined that you're ready for a total knee, and we do it together. And so total knee replacement is a great option. It's a 30-year wear rate. On recent studies show that with knee replacements. So it's the ability to get your life back, to do things that you no longer can.
Well, and what are some of those advancements then that you've seen in knee replacements? Because, you know, I know some folks in the past have been intimidated by doing that, but how does it look these days to go through with that procedure?
Knee replacements come a long way. We took an incredible procedure and made it even more precise. We utilize a Mako robot, so it's a 3D reconstruction of your knee. It's more personalized, and we're accurate to a fraction of a millimeter putting the knee replacements in. So there's a lot more to it. Knee replacements initially can hurt, they're sore, but within 6 weeks patients are generally very comfortable, and it can take 6 months to a year to get that final natural feeling of a knee replacement. But people do well very quickly. It's same-day surgery, they walk right away, and we guide you through the process, definitely. It's a team effort.
Yeah, I mean, same day, again, that's come a long way, but you've seen plenty of success stories, right?
Our success stories are far more than any potential small percentage of complications.
Yeah, and then just quickly, what can we do right now to keep our knees healthy?
Staying healthy in every aspect of your life really relates to your knees. I mean, it's about weight. Every pound of body weight is multiple pounds of force on a joint cartilage. So making sure you're active, keeping your weight down, nutrition, and moderate exercise, in fact, is great.
Yeah, that all makes a difference. But if you are, have some pain in your knee or want to look into taking some further action, you know where to go. There's the information on your screen, a number you can call, a website as well for Memorial Healthcare, and we appreciate all your information this morning.
Great, thank you for having me.